Hi Monica, this is my shoulder eval practice and response to the musculoskeletal ultrasound video. I thought it was very cool about how in depth the person went through all the different imaging for all the different kinds of injuries and how you could see the different injuries on a much higher spatial resolution than like or how you would see it on the musculoskeletal ultrasound. And I also thought that it was really cool that for a lot less microns, like 150 versus like 450, you could, and like the same megahertz, like 10, you could for 10 megahertz you could use a lot less microns to get better spatial resolution, and it looked really clear and really in focus. So I thought all the different injuries were very well documented, and I thought it was very educational. Alright, so when you first start off with the shoulder evaluation, you're going to do a past and present history. You're going to do a OPQRST on the patient's shoulder injury for onset, provocation, quality of pain, region of pain, severity of pain, and time. And then you're going to do a sample history also for signs, allergies, meds, past history, last oral intake, and events leading up to the injury. Then you're going to do an inspection of the patient for swelling, discoloration, deformity in the shoulders, if the posture is uneven, if the shoulders are equal, if the scapulae are winging in the back. Can you turn real quick? So they're not winging, which they would be like right here. And any atrophy or hypertrophy. And then can you stand up for me and put your arms like that, like face the camera? If the arms were unequal or uneven, yeah. So then we will move on to the bony palpitations. So you'd start off with the clavicle, and then you move up here to the sternoclavicular joint and back down the clavicle to the acromioclavicular joint. Then you move down to the humerus, go to the head of the humerus, to the bicipital groove, and then we would move on. Then the acromion process is back here, and the coracoid process is right there. And then we're going to do the scapula. So if you can turn around. If you could turn more, like that. So the inferior angle of the scapula would be like right there, and the medial angle of the scapula would be right here. The lateral border would be over here, and the medial border would be over here. The supraspinatus fossa would be like here, and the spine of the scapula would be like along here. And then we would move on to the soft tissue. So if you could turn 90 degrees like that, we'd start with the rotator cuff muscles, and for the soft tissue, if you could go like that again. So we start off with the supraspinatus muscle, which is up here, and then the infraspinatus muscle, which is like right here, and the teres minor, which is like lower than the infraspinatus, and then the subscapularis is on the anterior side of the scapula, and you can't really palpate that. And then we would move on to the deltoid. if you can turn this way. So the anterior part of the deltoid, the middle part of the deltoid, and the posterior part of the deltoid, and the pec major, and the pec major would be like right here, and the pec minor would be below that in there. And then we move on to the traps. So if you could turn this way. So the trapezius would be here, the upper trap, the mid trap, and then the lower trap would be there. The latissimus dorsi would be the sheet muscle would be like underneath here. The sheet muscle, it's like this big underneath it. And then we would move on to the rhomboids, which would be right there. So the rhomboids would be, rhomboid minor is above rhomboid major, and rhomboid major is like down here, and rhomboid minor is like in there, and that's where rhomboid major would be down there. And then latissimus dorsi. Oh, could you raise your shoulders real quick? And that's how you would activate the levator scapulae, which is like, okay, lower than that, which is like up here, all the way down here, and it goes up the neck. And then we would move on. Oh, could you turn this way? To the biceps. So the biceps would be all throughout here, and then the choriobrachialis, which is like don't flex it, but like right here. That would be the coracobrachialis, and then like you said before, the levator scapulae would be back here, and the serratus anterior are like the finger muscles right here, which they help protract the scapula, so they're like down in there. And then we would move on to range of motion. So first thing you do is a flexion 180 degrees all the way up like that. Yep. And then you would go down, and then you would do a extension back 60 degrees before, all the way back, and then an abduction like this. So just like that. No, like that. Yeah. All the way up, and then all the way down, and then adduction across your body 45 degrees, like straight. Yeah. And then horizontal abduction, which would be like up that way. Yeah. And then we would move on to that's horizontal abduction, horizontal adduction. And then we move on to scapular elevation. So you go like this, raise your shoulders, and then scapular depression would be lower your shoulders. Scapular protraction, you're gonna put your arms out like that and push your shoulders forward. And then scapular retraction, you're gonna keep your arms out, but you're gonna push your shoulders back, like pinching your back. And then we're gonna do internal rotation. So you're gonna go like this, 90 degrees, and back down like that. Internal rotation. And external rotation are sometimes also called medial and lateral rotation. And then we will move on to muscle actions. So these are resistance with all the range of motion. So you would do the same flexion as before. Keep your arm straight, and then you would go up all the way 180 degrees, all the way up, all the way up, yeah, and then all the way down. And then you would do extension 180 back, yeah, but I would resist it. So do it again, go back and resist it. And this helps the latissimus dorsi, teres major, and posterior deltoid, the flexion 180 degrees with resistance. Test the pec major, the interior deltoid, and the bicep. And then we would move on to abduction. So you're gonna keep your arm there, and you're gonna go straight out like that. And this helps the this tests the supraspinatus, the mid deltoid, and then you would do adduction across the body. So start out on your side, and then go across the body. Yeah, and then that would test the pec major and then latissimus dorsi. And then you're gonna go start here with this hand, with your left hand. Start here like that, and you're just gonna go out like that with the resistance. Which tests the pec major, subscapularis, latissimus dorsi, and teres major. And then you're gonna start out there, and you're gonna go back, so you keep it 90 degrees, like that. And then you're gonna try to go in, and that external rotation tests infraspinatus and teres minor. And then you're gonna do horizontal adduction. So you start out all the way like this, with your arm all the way out. Yeah, and then can you do it with the other arm? Yeah, and then you're gonna try to go like across your body, and I would resist this. And the horizontal adduction is for the anterior deltoid, the pec major, and the choriobrachialis. And then you're gonna do horizontal abduction. So you're gonna start across the body, and you're gonna go all the way out wide. I'm gonna resist that. And that's testing the posterior deltoid, the latissimus dorsi, and the teres minor. And then you're gonna move on to subscapular movements without. I can't resist that really. So you're just gonna do abduction, rotation. So abduction or upward rotation, you're going like that and push your shoulders forward, which tests the serratus anterior on the side and serratus anterior. And then you're going to do shoulder elevation, which is for the traps and the levator scapulae. And then you can do scapular adduction. So scapular adduction, you're going to put your arms behind you and squish your shoulders back. Could you turn around for me? Yeah. And then squish your shoulders back. And then for the scapular adduction, this tests the middle trap and the rhomboid major. And then you're going to do scapular depression / adduction. So you're going to put your shoulders down and this tests the lower trap, and then you're going to do scapular adduction and downward rotation. So you're going to squish your shoulders back again, but lower them at the same time. And this tests the rhomboid major and the rhomboid minor. So you can turn around for me, please. Next thing is the neurological test for the and then the motor functions, and this would be, so you start with C5 motor, so you go like that, just keep your arm straight down like that, yeah. And then C6, you go down like this and put your wrist up, yeah. And then that's the wrist extensor group. C5 is for deltoid. And then C7, triceps, wrist flexors. So you're going to go triceps down like this, put your arm straight, and then you're going to go wrist flexors. So go that way, and then you're going to go finger extenders. So like that. And then C8, you're going to go like this for the finger flexors. And then T1 is going to be finger abduction, adduction, so like Spock, yeah, like that. Just to test the motor function of your fingers. And then we're going to move on to sensory. So in the anatomical position, you can sit down, just put your arm out like this way, like that. Yeah. And then for this the C5, this would be testing to see if you could feel the same thing on both sides. So the C5 would be all the way up here. Then your thumb would be C6. These would be C7. These would be C8, and this side would be T1. And then after that is reflexes. So the reflexes would be C5 biceps tendon, which is you'd go like this, and I would test it by hitting right there for the C5, and then you'd go like that, and then I would test it by hitting here for the C6 brachioradialis tendon right here. C5 would be for your biceps tendon, and then C7 for your triceps tendon. You would go back like that. Yeah, and I would test it by hitting here. And then for the pulse, I need a timer. I'm gonna go grab a timer. Alright, so for the pulse, I'm gonna take it for 15 seconds, so I'm gonna start now. Alright. And so that would be 80 beats per minute for your pulse right now. And then so we would say strong and regular. And then for recapillarization, you put your fingers out. You don't have any nail paint, so I would just pinch this, and if the color comes back, then you're fine. And that is my shoulder evaluation, and we would compare that bilaterally. Yes. Thank you. Goodbye.